My name is Tricia Bradley, and I am one of the dietitians here at the hospital. I've been here at the University of Chicago Medical Center for 4 years, and the thing that attracted me most to start working here was I really like the fact that it's a teaching hospital.
My name is Christy Stavros, and I'm also a dietitian at the hospital. I've been here at the University of Chicago Medical Center for approximately a year and a half, and originally I came here because of the University of Chicago's reputation. The reason why I became a dietitian was because I was very interested in nutrition, and that led me to the bariatric population. Kind of seemed like that population was pretty forgotten, and I felt very strongly about helping them achieve weight loss success.
The thing I like most about working with the team here at the bariatric center is the respect that everyone has for each other. The surgeons, not only are they brilliant and they give a lot of good information to us, but they're also very personable, and we have a great team to work with. So once you meet with our team, you'll meet with the surgeon, the dietitian, the psychologist. We meet as a group and we discuss the different things that you talked about in your interviews. And so basically we come together to see if there's any testing that you need done. Some patients, if they haven't tried a supervised weight loss program, they will be required to do 3 to 6 months of a supervised weight program, and the psychologist oftentimes will have recommendations as well.
And I think the best aspect of this for the patient is that because it is a team approach, if there was something that was missed by another discipline, we're able to address that at that time.
So from the time that you come into your first visit, you'll always meet with a dietitian, and then prior to your surgery, we always have a nutrition class so that you feel comfortable with the diet after surgery.
We encourage patients to, if they're drinking carbonated beverages or if they're eating high fatty foods, sugary foods, we ask them to try to eliminate some of these just to make the post-operative diet easier for them to handle, because it is quite a change after surgery as far as dietary changes.
Within the first 3 weeks, you're going to be on a pureed diet, and obviously your portions are going to be much smaller. We encourage 4 to 6 meals throughout the day because it really is important not to skip meals, to still get nutrition throughout the day. Your portions are going to be very small, 2 to 4 ounces, which if you have a measuring cup, that's about 1/4 to 1/2 cup. We do encourage plenty of fluid intake, but that's going to be in between meals. We don't want you to fill up and not be able to eat. And then we'll always visit you in the hospital just to check in, make sure that you're doing okay. And then for your first clinic visit, of course, we'll see you. Every follow-up visit, you'll always be able to check with a dietitian. And so we really want to make sure, because nutrition is such an integral part of this surgery, that we want to make sure that you're always given that care. So you'll always see us. We're always available also by phone, by email, and so we're always happy to help at any time we can.
There are support groups here at the University of Chicago Medical Center, and they are the first Tuesday of every month, and they are held in the DCAM building, and anybody is eligible to come, and we welcome everybody, even pre-op patients and definitely the post-op patients, as far as they, as far out of surgery as they are.
So at each support group, we always present different topics every month, and then we allow for patients to discuss any questions they have, any concerns. And what's great about our program is the support group is free of charge, so there is no cost. If you're having concerns, if you're running into troubles, there's always a psychologist as well who can help you with any issues that you might have. And it's important to just have a support system, not only here, but either with family or friends, just to kind of help you get through the whole process.
So success really depends on the individual patient. If they are willing to make changes and kind of stick to their diet program, their exercise regimen, then they will definitely be successful after bariatric surgery. During the first year, it's definitely kind of a honeymoon phase where they're losing weight, everything seems like it's going well. But I think the real challenge is a year or 2 years out of surgery to kind of maintain the healthy eating and lifestyle changes that would definitely make a difference.